Hello, I'm Joel Barthelemy. Judging from a recent Congressional subcommittee hearing, both Democrats and Republicans appear to agree that telemedicine has too many advantages to ignore.
This technology offers the promise of connecting small physician practices with patients, other medical providers, hospitals, and areas that are medically underserved. Today, some small practices are finding it difficult to stay afloat due to the burdens of complying with the health care law and the cost of operating a small practice.
The technology we need is ready. However, our nation's healthcare system is not. In the coming years, we as a country will have to address how telehealth care is reimbursed, how and where doctors are able to practice remotely, and how to handle sensitive patient information.
Testifying on Capitol Hill, Dr. Karen Rubin, former president of the American Telemedicine Association, pointed out that Medicare limits who can see their physicians via telemedicine.
Last year, sadly, Medicare reimbursed less than $12 million nationwide for telemedicine-related services. A patient or provider's zip code should not determine eligibility for telemedicine care when, on the other hand, our Medicare and Medicaid programs spend many hundreds of millions of dollars annually on transportation costs. As an example, last year, our UVA program saved patients more than 4.8 million miles of driving for access to care, keeps patients local in their community.
Another witness, dermatologist Brenda Dideman, was asked about liability issues involving the use of technology.
A lot of care is already provided via the phone with very little details and with sometimes misinformation communicated through a phone. Whereas with the use of video or store and forward technology, you're getting so many more details and so much more important information that allows you to make a very important triage or a suggestion to advise the patient to come in, to advise the patient to go to the ER. I think that in many ways it protects the physician to have telemedicine as part of their practice.
The purpose of the hearing was to explain why Medicare should expand its telehealth reimbursements. Simple, because Connected Health would improve care and save money.
For example, if we bring the care to the patient, we can evaluate a leg ulcer or an early infection more quickly and get the care implemented so they do not end up a patient that's hospitalized. Secondly, I think one of our biggest patient populations is our obese and diabetic population that can be monitored through teleophthalmology. They can be monitored through teledermatology. They have leg ulcers are, again, a big cost to the healthcare system, as well as the other complications of diabetes. So I feel that we can see this in many specialties, that we bring the care to the patient and the system will save money.
Representative Collins summed up the testimony nicely.
What we've seen here is common sense. You know, we like to think that common sense should carry the day. And technology has now moved us to a place we can better serve an aging population or in a rural population where we know there's going to be a shortage of doctors. So, I mean, I think common sense says we need to move this forward. If a doctor doesn't get paid, they're not going to participate.
I'd like to believe that common sense will prevail in Washington. Perhaps this time it will. I'm Joel Barthelemy. Would you like to see more convenient health care for our senior citizens that will save taxpayer dollars? Send me an email. My address is Joel's blog, that's JOELSBLOG @globalmed.com.